Grey County.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Welcome to HealthLink, the program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome to the program two guests, Ian Reich from the Public Health Unit here in Grey Bruce, and also Andrea Donaldson, who's a member of our community who's going to come and talk to us about some experiences that she's had. I want to welcome both of you to the program, and thank you very much for being here today.
Thank you for having me.
My pleasure. So today we're talking about opioids and people who've had lived experiences, and also from a public health perspective, some of the challenges we're seeing with people who have overdosed. So Ian, would you like to begin? I know you've got also a new portfolio since you and I chatted. So I wonder if you can just update our audience about what other hat you are now wearing. And then I'll let you and Andrea just take the show away.
Absolutely. Thanks again for having me on the show again. So you are correct. I have inherited an interim director role here at the health unit while we recruit for a full-time replacement. However, I am still staying focused on my management role for the harm reduction, substance use, and sexual health program here at the health unit. And to just give a general level set about why we continue to talk about opioids and the overdose epidemic that is happening here in Canada, but specifically in Grey and Bruce, is because it's still happening. We're losing people, unfortunately, at quite an alarming rate here in Grey Bruce, but also throughout the entire country and the world for that matter. Some countries obviously hit harder than others, Canada being one of those that does have significant numbers of overdoses related to opioid poisoning compared to other parts of the world. Here in Grey Bruce alone, just this part of the year so far, we are aware of anecdotally 8 fatalities related to opioid overdoses here in the city and Grey and Bruce entirely. What that really tells us is that the initiatives that we have in place to help people save their lives, they are working, but the issue is still growing. For just to sort of put some numbers out there, last year we distributed near 1,500 naloxone kits directly from our health unit and our partnering agencies. And of those, we know at least 150 people used them to reverse an overdose. So that number so for last year, we know of up to November, there's 18 fatalities in Grey and Bruce. So if we say that the initiatives we were not doing, such as distributing naloxone or providing safe injection supplies, giving people information about overdose prevention lines, that sort of thing, if we didn't do that stuff, think of what that number of 18 would potentially look like. Naloxone works, it is saving people's lives, but trauma, mental health, and addiction issues are persisting. And if not, they're getting, I don't want to say worse, but they're definitely not resolving. So that's really a hugely important issue. We need to figure out why that is. And one of those big pieces of why that is people that do struggle with addiction and mental health issues, a lot of times are not comfortable coming forward to ask for help. And the reason for that, not the only reason, but one of the main reasons for that is the stigma that's associated with people that are going through substance use challenges. And this week, in preparation for this call, I was really thinking to myself, how can I better frame this for individuals? And really, I want people to start looking at addiction not as an illness. Addiction is a symptom of an illness. The illness is a mental health or a trauma. The addiction is simply what people are using to cope with the pain that they're feeling on the inside. And I'm talking not just physical pain, but the mental pain. And this pain is so different. It's deep. It's embedded inside of you. That really, to just claim the addiction as the illness, it's not true. It's part of the illness. It's a symptom. It's a representation of what is happening in that person's life to try and cope with what the pain they are feeling on the inside. And for opioids, I've said it before, opioids are unbelievable drugs at numbing physical pain, but they're also probably the best drug that's out there to numb that mental pain. It allows you to forget of that hurt that's going on inside of you for that short period of time while you are using. So I really think that will help people understand not to look at people struggling with addiction in a negative way. Look at it in a way that people struggling with addiction are truly showing symptoms of needing help and needing arms wrapped around them, not needing to be pushed away any further. So that's really, if anything that I can say today, that's what I really want the public to understand is love, compassion, understanding, and educating oneself is probably the number one cornerstone of how us as a community can start seeing some improvements. And I think that's actually a really good segue to pass the torch over to Andrea to maybe share what her story is about, because every person's story that has struggled with addiction is slightly different. But when you look back at it, a lot of the times there's something that happened. There's something really important that's in their history. And it really paints a much clearer picture. And I've said it also time and time again, opioid addiction, any substance use issues, they do not discriminate. They don't care who you are. And that's because mental health does not discriminate either. It can affect absolutely any one of us. And just like we take a pill to take care of a stuffy nose, we'll take a pill to take care of that intense pain that's going on in our heads as well. So without further ado, I think maybe let's just have Andrea introduce herself and share her story. And Andrea, we're here to support you through this as well. So we'll pass it over to you. And thanks again for coming on.
Thank you. Well, I'm Andrea. I'm 37 years old, and I was a active addict for 20 years of my life. I started when I was around 12. Like most kids, I started with cigarettes. And by the time I was 13, I had moved up to drinking and cannabis. And I was doing that whenever I could. But at 13, you don't have much leeway, like being able to go out and stuff. But when I hit high school, so about 14, I started selling weed and I was partying every weekend. I was rebellious. But I wasn't trying to hurt anybody. Like, more specifically, like my mom, she was my rock. She was my everything, my best friend. And unfortunately, I lost her when I was 17. She passed away. And when she passed away, I just dove over the cliff. I went in head first. I was drinking sun up to sundown. By the time I was 18, I was using meth every day for quite a while. And eventually, like, I graduated into using needles. And it became a point where it wasn't even the drugs that was the addictive part. It was the needle itself. It was just the feeling to feel, I don't know, I guess to feel alive, to feel human, like, and not feel like, I don't know, the trauma and all that. It was comforting, I guess you could say, in a really terrible way. Not the comfort that any addict should be reaching for. When I first came into recovery, though, I was scared. To a lot of people, it also looked like a sign of weakness, like, you need help to come off something, but this is coming from people that have never experienced addiction. So it's easy for those people to say, like, just quit, or, quit complaining, or, stuff like that. And that's also a stigma that should stop, because it's not easy to quit. It's very painful. It's a lot of work. It's not as easy as just waking up one day and saying, okay, I'm done. And that I wish more people would understand that. I see it all the time on Facebook and addiction groups. Parents talking about, like, their children. I don't understand, like, why they can't just quit. And I'll come in and I'll comment and I'll explain it to them. And by the time I'm done explaining, then they have a better understanding, and their mindset has changed, and they're more supportive and understanding towards their child's situation that they're in with addiction. Back in Grey Bruce, like all these people that you, Ian, had mentioned that have passed away from overdose since 2020, I know all of them. Every single one of those people, I knew them. They were my friends, family, and it's very heartbreaking. It's come to a point now, every time I log on to Facebook, I get a little bit of anxiety just wondering what who's gonna be gone next, because I know so many active addicts back there. I know a lot of them are struggling. There's a lot of them that want help. They need help. Unfortunately, though, with their G&B house there in Grey Bruce, there's only 16 beds there, and in Owen Sound alone, there's got to be at least 300 addicts, and 16 beds, it's not enough. There needs to be more. I'm not really sure how that goes about, to get a bigger rehab or something. Even a safe injection site would be great. It would take the majority of the needles off the street. You wouldn't see as many people walking around, nodding off. They would be somewhere safe. The overdoses might deplete, the numbers might deplete, because there would be somebody right there. You wouldn't have to trust your buddy to call 911 if something were to happen, or you just wouldn't be alone, you know? I know a lot of people are against them, but they're at the same time, they're also against seeing all these needles lying on the sidewalks and on the walking trails. So you got to make up your mind, you know? You have to pick or choose, because you're complaining about both things, but one thing could actually solve the problem, but you don't want it in your neighborhood. But you also don't want these needles lying on your front lawn. So, you know, the stigma, it's got to end, because it's solving nothing, you know?
Absolutely. And that's, if I can jump in, Carol, that it's a wonderful sort of segue, because back in September, the Board of Health definitely did approve, you know, moving forward with what's called safe supply as an initial starter to this conversation. So we are really looking forward to pushing that conversation forward, because it is one piece. Safe supply is one piece to get the toxic out of the drug, and make sure folks have safe supply that's not toxic, not laced with fentanyl or carfentanil, that sort of thing. And that's step one. As with all change, especially in a population that does have a fairly high rate of stigma related to substance use, change has to happen slow enough that the public will accept it, and not too quick, so that you're faced with, you know, that door slammed in your face type thing. Saying all that, everything Andrea mentions is 100% right on the money. Any option that we can provide the public with solutions to make sure that, one, they have a safe place to go to use, and in that safe place, they have real-time access to mental health, social work, housing, all those supports that are needed to ensure that that person's life has those main determinants of health in place. Things like shelter, food, clothing. If those things are in place, success is so much more likely. If someone is still struggling with living on the streets, not having a steady income, not having all those normal comforts that we're used to, recovering is so much more difficult. And places like recovery centers that are holistic in nature, that can provide not just the physical withdrawal symptom relief, but also that support down a new path of how to live a life post-recovery, are just huge steps that are needed. And as we can sort of look at our current healthcare system, there's some missing pieces. And I think it's work that we need to do as a collective, not just the health sector, not just the social sector, and not just the public. Everyone together needs to come up with these solutions and plans for how we as a community can improve and can heal. And I'll point to a video called Rat Park. For anyone that's watching and interested in Googling it, if you can Google Rat Park, and that's what I mean by creating a community that is good for all, ensuring that everyone has everything they need to live a healthy lifestyle. Critical to ensure that people are not in that state of pain that they need to turn to drugs to alleviate that sort of thing. So thank you so much for bringing those points up, Andrea, because it's spot on the money, and we definitely need some solutions in place.
Like I said, I'm happy to sit back. You guys are doing amazing. I do have a few questions.
Absolutely.
If you don't mind. Ian knows I always have questions. So, Ian, what you're discussing are the wraparound services. Like, to me, that's such a wonderful visual. Andrea, I can't help but think, that the courage it takes for you to even be here today is amazing, and I thank you for that. But the courage to try and seek recovery, I mean, that would take such strength at a time when you probably feel the most vulnerable. Do you mind sharing how you came to that for anyone who's listening today?
Well, when I decided enough was enough, I was tired. Well, I was tired of the lifestyle. But what really, I think, threw me into even thinking about recovery was I had 3 overdoses within 3 weeks.
Wow.
And I didn't want to die. I knew I didn't want to die, but I also didn't want to feel the pain and the trauma and everything I went through, like, for all those years. Like, there were, in and out, like, I was in and out of jail. There was physical violence. There was just, it was everything. And I was scared to feel again. Like, I knew that if I went into recovery, I would have feelings, and that scared me. But I also wanted to live. I also have 7 children. So, I have all these little people depending on me. And so I got clean on my own. I didn't do rehab. I didn't do detox. At first I was kind of a closet case in recovery. Nobody knew that I kind of just disappeared from the scene, from everybody. And then one day I just decided, you know what, I'm gonna out myself, and I put a post on Facebook about my addictions, that I'm in recovery and all this, and just the love and support that was thrown back at me kept me going. And it still does every day. Every day I still get messages and, love and support from people like I've never even met in my life, from all over the world. And it keeps me going because I know that my story is making a difference for other people, and it's helping other people, whether they're in active addiction or if they love somebody in active addiction. I've got it from all sides. So it's not, recovery in the beginning, it's not easy. I would be lying if I said it was. It's terrible. It is painful, but it's doable. You will not die from a withdrawal from drugs. Alcohol, you should seek medical attention if you're coming off alcohol, for sure. But like opioids and cocaine and meth, you're gonna feel like you're gonna die, but you're not gonna. Because here I am. I'm almost 6 years clean and sober. I didn't die. I made it through it. I made it through the sweats and the leg pains and the restless legs and the sleepless nights and the tears and all that. I made it through it. And if I could do that, I truly believe anybody can do that. I know a lot of people they'll sit there and say, I can't do that. There is no way I can do that. And I was that same person for 20 years, So, but I did it. And honestly, the biggest victory that any addict could achieve is making it through the first 24 hours of recovery. And whether they believe that or not, if they can make it through those first 24 hours, they can make it through anything, even 48 hours.
Yeah.
You just got to believe in yourself, and you got to, even if it's a stranger, like even me, like if anybody's watching this, like, and they're struggling and they don't feel like they have somebody in their life that they could get that type of love and support from, and I do have a Facebook page, Andrea's Journey, that Anybody can message me on my stories on there. So there's a lot of educational posts on there, everything. So if you feel like you have nobody, I'm here. And I don't judge. I am not one to judge. I'm the last person who should judge anybody. And I will support you. I will help. I will do whatever I can to help you achieve recovery and a better life and learn to love yourself again.
You know, that's such an important point, because we talk about the loneliness in other programs, you know, how isolated people get. And one of the concerns is people will use alone, you know, and that's not what we want. We want people to have people who can help should they overdose.
Yeah.
But having the supports you mentioned earlier, people don't know if they haven't been through it. And having people like yourself who have lived experience helping those who are considering recovery and just wanting it is important. But it's also important for those of us who want to help develop programs or services. You know, we can sit around a table, but unless people with lived experiences are right there, it's really, I think, we're missing the most important link are those who are living and continue to live lived experiences. Would you agree, or am I way off in left field here?
No, absolutely. Yeah. And another thing too, like everybody's recovery is different as well. I don't feel they should all be treated the same way. Because like I said, not everybody is the same. Their stories aren't the same. Their recoveries aren't the same. Their drugs of choice aren't the same. But I find that in certain programs, they're all treated the same. Instead of as individuals, like healing at their own course, if that makes sense.
Yeah.
Yeah.
It makes perfect sense to me.
It does.
A lot of times in healthcare, we like to develop programs to increase efficiency, reduce costs, improve staff satisfaction. A lot of times, however, when you do that, you omit thinking about what the client or what the patient needs. You sometimes lose that patient-directed or patient-first approach, which I really think, especially when we're dealing with mental health and addiction, we need to make sure that those recovery plans, or even if it's not recovery plans, but the plans for that client are tailored to that client's specific needs and not to an agency's requirements or needs. Obviously, we have to follow rules from the government and whatnot, but we should definitely design things in a way that meet the needs of everyone, not only look and focus on the needs of the employee or the organization. So I really think that client-first approach, holistic, looking at them from head to toe, not just for what's wrong with them, but understanding the entire person and how that person needs to heal, I think is critical when you look at these types of programs and initiatives.
I have a question for Andrea. As someone, because the more information you share, the more we can support. We mentioned love and compassion and support. What would you say to members of the community who happen to pass by someone who's obviously under the influence on the street, or, you know, what are the helpful phrases, or what should people do that at least would demonstrate that person should not be discarded, that they should not be treated in a way that may be not very positive? What can you tell us about how we can change our behavior?
It's really what made a difference in my day, like wandering the streets, is somebody would smile at me and just say, "Hello, how are you?" It was so simple. And it made me feel like, oh, this person, like, they acknowledge me, so I'm not just completely nobody because they can see me, you know? Like, it's very simple, just kindness. You know, if you see somebody, you know, that's maybe crying, they've had it, just say, "Hi, how are you?" Like, do you want to talk? Or, you know, just offer some support, or even just a smile. You don't even have to talk to them.
Yeah. And in other words, treat them like a person, like an individual.
Because they are people.
Exactly. They are people. What would you say to the community when occasionally people ask for money? You know, they will ask, what would you say? I know there's always that, gee, I don't know what to do. Do I do it? Do I not do it? What should I do? What would you say?
I would personally, because we all know where generally that money's going to go, and that $5 that you give them, that could be an overdose to them. So it's probably not the best idea to give them money if they're asking. But you could say, is there something that you'd like to eat? Like if there's a store right there, you could go in and buy it, or, you know, get them a drink or a snack or something. Because sometimes that is all they want, but it's so hard to tell. So if you offer them food and they don't want it, then you obviously know why they wanted the money. But I would suggest not giving it to them. Some of them can get kind of hostile about it, but
it's a really good strategy. I know I entered a local grocery store and someone had asked specifically for money on my way in. And I remembered that. So I purchased an extra sandwich and a drink and brought it out and put it down beside him. And the smile that I got in return for something just as simple as that, it did a couple things. It gave them food for one, but it also made them aware that people were watching and realized that they are human, just like all of us, and human, but not just that, Absolutely. They're in need, in great need. So the more you push away, the less they feel worthy, and the more it just perpetuates that mental health challenge, the feeling of unworth, that sort of thing.
Yep. And if you don't feel worthy of anything, then you think, what's the point? Why try? Why try and get better if nobody cares anyway? So if the community were to start like showing, more smiles and stuff, eventually it's going to be a better outcome. I believe it will be.
Because we're all in the community together. We are together.
Absolutely.
We just need, and for us and for others, to know how to help. How can we support is the key. I can't believe our time has passed. I want to thank you very, very much for sharing your story and for allowing me to meet you. Thank you. Ian,
as always,
for having
me.
My pleasure. And you're welcome back anytime, because what you share is absolutely could save someone's life. So thank you.
Thank you.
Ian, as always, thank you to you. And please join me again.
Absolutely.
Thank you to our viewing audience. Please join us again to learn more about programs, resources, and services available to you. Take care, stay safe, and care for each other. Thank you.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
He fell.
Whoa, I'm not driving. I'm way too stoned. How are you feeling, Veer?
Oh, since we had that talk, I'm not driving tonight at all.
What about you, Dave?
You only had a couple of drinks.
And only a couple of puffs.